So one of the things that I've been focusing more on in my practice is diagnosing and treatments of peripheral arterial disease. A lot of the patients that we see are diabetic, smokers, and these are pretty significant risk factors to having plaque buildup in the arteries. And if it gets too much, you can block an artery and you start to have circulatory problems in your feet. They actually did a study, and there's about 20 million Americans who have peripheral arterial disease, and of those, only about 7% have been diagnosed with the arterial disease. And so we're starting to catch that, and we're able to get people better quickly with that arterial disease. So one of the ways that we test the arterial flow in the foot is with something we call QuantaFlow. The QuantaFlow is a simple program with a probe, and we stick the probe on the finger and to get a waveform, a measurement from the computer, and then we also put it on the toe and get a waveform, and we compare that to get our reading. And if the blood flow is better in the finger and not as good in the toe, then it'll let us know the severity of the arterial disease. It takes about 5 minutes to do the test. It's non-invasive, it doesn't hurt. So we do the test at rest, and then we also have the patient move their feet up and down to give and simulate what walking or increased exercise would do. Sometimes if you have very severe disease, that increase of activity can starve your muscles of blood flow, and we get a more accurate reading of how bad the arterial disease is. This is, of course, really important with diabetics and smokers who are at risk for this peripheral arterial disease. In some cases, diabetics that don't have enough blood flow, you can have injuries to your toes that you can't heal, your feet, and then that's when you hear horror stories about amputation. So there's pretty quick tests that we can do which we can look for that and catch that early, which I think is pretty important for our population.